Well, Dr. Fehrman, you did talk about the other couple, the type of braces, the more traditional metal braces and the porcelain or the clear braces. Let's talk a little bit about Invisalign. What are the pros and the cons of Invisalign, and how do they really work?
Well, Invisalign is a clear acrylic or plastic shell that snaps over the patient's upper or lower teeth. And it's made on a computer in a lab off an impression of the patient's teeth. And every 2 weeks, the patient has to snap a new aligner over the teeth, and it basically bumps the tooth a couple weeks at a time into a new position. And it works very well for smaller problems like crooked slate crowding of the teeth, slate spacing of the teeth, tipping of the teeth. It doesn't work very well for certain other problems like fixing the bite or severe crowding or severe spacing. But it certainly serves a purpose.
All right. So basically, if there is lots of teeth, very, very super crooked, Invisalign might not do the trick. Is that what you say?
Yes, that's correct. A lot of the patients that come through the front door think they want Invisalign, but once I fill them in, they're really not candidates for it.
All right. That's a clinical thing. Now,
yes.
So I got that. And you mentioned something about the bite. Can you just slightly explain what that means, the bite?
Okay, well, the bite has to do with how the upper teeth fit against the lower teeth. And with traditional braces, we have the patient wear rubber bands or a myriad of other appliances to fix the bite. Invisalign can tweak the bite somewhat, but not anywhere near as much as you can with full braces.
And even though that's off the topic of Invisalign, but since you mentioned it, what is not having your teeth fixing correctly, meaning not having a good bite, what does that do to the patient? I mean, does he care and should he care?
Well, he should care. Orthodontists feel that is the most important part of orthodontic treatment, of course. The patient sees what's wrong in the front of their mouth with the crooked teeth or spaces or whatever, but the bite is actually what's the most important for longevity of the teeth, and that's the ultimate goal, is to get things to fit together right and last forever. So people with a poor bite or malocclusion tend to have a lot more wear and tear on their teeth, so that the teeth get all beat up when they don't fit together right. They tend to break down, so those patients need more crowns and more bridges because their bite is off.
Why?
And certainly, and last but not least, it causes temporomandibular joint problems in certain types of malocclusions, which is the jaw joint back here.
The hinges, like the door hinges where the bite goes together here.
Correct. And it can cause headaches and muscle pain and things like that.
Oh, so, yeah, we're talking problems here, because who wants to be at work or for that much at school with headache and muscle pains? So we're going to talk about that a little later. So I understand. So basically, if there is not an alignment of the teeth correctly, then sometimes Invisalign cannot fix that anymore. You've got to go for the traditional braces and stuff like that.
Yes, I would say that's correct. It serves a certain purpose, but it's certainly not for all malocclusions.
Mm-hmm. Now, I've heard that Invisalign was kind of originally more like invented for the adults, simply because of discipline, because children will take that aligner out and put it away, and which apparently, you have to take it out for eating, which is a good thing compared to the braces, because you take it out, you can brush and floss afterwards, and then put it back in, where with the braces, you can and must brush and floss, but it's more difficult. And then you have that spinach flag, hanging in. You don't have that with the Invisalign. However, a 14-year-old, might just have seen a pretty girl across the table and forget all about it, putting them back on after lunch, and then they are getting swept up by the janitor. And adults do that. Shed some light on that a little bit. Is it only for adults, or is it only for teenagers, or and who should use them or not?
No, it is for adolescents as well. But you have to remember adolescents are still growing, so the treatment has to progress over a certain 18-month period of time so that the bones don't change in size, because then the aligners won't fit, obviously. So you're right. It started out as an adult treatment only, but now it has been expanded to adolescents. And one of the advantages is you can remove it to brush your teeth and to floss, but that's also one of the disadvantages because teenagers throw them away at the food lunch tray. So.
But the adult who has a couple crooked teeth might do quite well with it.
Could you say that again, please?
The adult who has a couple, 2, 3 crooked teeth in front, he might do quite well with it.
Yes, I think that would be the perfect candidate. Yes.
Right. Okay. Good. And it is an advantage because braces. One of the big problem with braces is that you got to do really, really well in maintenance of cleaning, brushing, and that is more difficult than not having them. Otherwise, you develop gum disease, and so in 2 years you have straight teeth, but they're all falling out because you have gum disease, and that would kind of defeat the purpose, right?
Yes, that's true. Certainly one of the advantages is it's removable, but I don't know, braces aren't that hard to brush around, but it's certainly a commitment.
Okay, good. And let me ask you, are those Invisaligns really invisible?
No, that's kind of a misnomer. Invisalign is not invisible. It's a clear millimeter or 2 thick shell snapped over the teeth, so it looks kind of like a mouth guard on the teeth, but it's clear, not cloudy. But you can see that it's in the mouth, and people talk a little bit funny at first, but they get used to it.
Okay. But it is, so for instance, let's just say an adult, or for that much, if a teenager, if he has that all-important job interview or that first date, and he's a little self-conscious, he could take it out for that time. As long as he doesn't get used to taking it out more than in, he'll still be okay, right?
Yes, that's correct. You can remove it for a period of an hour or 2, 3 or 4 even, no problem, but you may not progress to the next aligner quite on schedule if you miss a lot of time, yes.
Sure. So it's, that's where the discipline thing comes in, it's, yes, you can skip 1 exercise, but then you have somebody like me, he skips 9 out of 10 exercises, and that doesn't work so well anymore.
Yeah, I skip 11 out of 10, so.
Yeah, I know. I probably should have said that same. Well, all right, Dr. Fehrman, I think that sheds some light on Invisalign, and I appreciate that. Thank you very much.
Yeah.